ho because me explanation baby mu tracy kosi but my main sanka obi say a lawyer ba be kan ho but before the yenko a minority health committee no so parliament honorable Kuganab a member of the health committee ono say health professional doc Pacho anope good morning.
Good morning.
Pacho ho ye there?
Oh yeah, but my tree is not very good.
Your tree is not good. Okay, let's do this in English. So, Doc, you are on the health committee in Parliament. Now, you raised concerns in recent times about how government is managing this whole pandemic. We've seen the cases are going up. Today, the latest count is 5,638. Is this something that we're doing wrong? Hello, Honorable. Oh, Doc, I want article. You better say I could Doc and change a member of the health committee or parliament, but a lawyer can say human rights lawyer will be any no. Ghana Hanum say lawyer Martin Pebu and so about the kind of studio. Lawyer, I don't pay him much. I just saw here. That's it, Papa. Lawyers who can say I start to question social distancing. Whether I'm random with the year, Juma, chambers in Yedma,
but we observe it. Man, so make sure.
This is our bed, meters. If we are going if we are dangerous.
Some women no more shady. Me say, but dog, Mammy Musa legal issue be okay. Mammy come and say about because you perceive, especially say here now what you want say, man swam between tourism authority ministry of tourism about say here no whether me way one authority but so chair no more me answer na legal so doc good morning again. My apologies, your line went off. So back to the issue I was asking you, which was that what are we doing wrong that we appear to be seeing increased number of cases?
Well, I think doing our best. And but certainly there are difficulties, and now we see that there's more of community spread. But let me touch on a little bit about index cases.
Okay.
You see, I think that we should de-emphasize that fact because stigmatization is one of the things that would lead to people not being able to report when they realize they have symptoms similar to what COVID-19 is all about. You see, certainly it is persons to persons that result in what we have. And somebody might have brought it to somebody. For example, somebody could also ask the question, who brought the disease to Ghana?
Okay.
Who brought the virus to Ghana? And so in our local situation, if we keep on emphasizing the fact that it was one person who infected this number of people, blah, 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 we would build a lot of stigma and will create very difficult problems for people who have the virus and their families. And so at this point, I want us to de-emphasize that because stigma is one of the reasons that is continuously leading to the spread of the disease. Having said that, we still have a chance. And that chance is we know where the disease, the virus is spreading. We know where it is. And so, for me, we can do some level of restrictions of movement because we know that when people move, the virus moves. And so it is not too late to restrict movement. Lockdown, we may not have to use the word lockdown because now that word has become something else.
But Doc, are you saying that we should go back to lockdown now with 3,638
No,
cases?
I'm not saying we should go back to lockdown. I'm saying we know the areas. For example, Obuasi is now a very, that is where we see numbers increasing hugely. But we can contain Obuasi. We can ensure that for that area, we restrict movement. And when we do that, we helping the population. And we helping everybody in general. You see, the word lockdown has been misused. And we don't have to continue to use that. We have to find a way. Because when you talk about lockdown and people have to go out and people are restricted, you see, the whole country can become paralyzed. And when the whole country is paralyzed by the disease, what happens?
So Doc, I want to get your suggestion very clearly. So you are saying that in particular areas where we've seen the virus or we've identified them as hotspots, for instance, Obuasi and Tema, should we restrict, impose a curfew, or which word would you, which strategy would you prefer?
You see, I don't want to use political words. I want to find us all together using terminologies that is understandable. In the control, we are all aware that we don't want people to move too much freely. So what do we do in this instance if we want to control the disease? What happens?
But Doc, is government not doing enough? Already, government has sent a team of officers from Ghana Health Service to Obuasi. They are doing enhanced and aggressive contact tracing over there. They are doing works in other, for instance, in Tema. They've identified all the factory workers. They've traced all their relatives and their contacts. So is that not enough? What kind of restrictions again are you suggesting that they impose?
That is not enough. You know, we are so mobile. Ghanaians are so mobile. And they may do the contact tracing by the time they are able to get all. Remember that the fellow you've gotten now, if you trace the fellow and he has it, then you continue tracing because he would have also contacted people. And so
yeah, but Doc, hang on, Doc. But are these people all not traced, identified in the enhanced contact tracing?
Oh, you cannot do that.
You cannot contact.
You cannot do that effectively. There's no way you can do that effectively. What we have to do now is to zone the areas. We know the hotspots, and all the hotspots must be declared restricted zones. That's what I'm saying. Okay,
restricted meaning that nobody should be allowed to travel into the hotspots or out of the hotspots.
You see, I don't have that authority to pronounce very difficult.
Yeah, but Doc, you are suggesting something. So I want your suggestion to be very clear because you are a member of the health committee. So if you are saying that it should be restrictive, don't be ambiguous. Restrictive in what sense?
Restrict the movement of people in the hotspots. So whatever measures the government will take, the whole idea is restrict. And so government has to analyze how it's going to reduce the movement of people, and for that matter, the movement of the virus. Okay. And we have identified hotspots.
Okay. So for now, what government is doing is not quite enough with these.
But it cannot be. If it were enough, the numbers wouldn't have been growing.
Can any government, for that matter, manage, control the numbers? Is it possible to control the numbers?
It is possible when we control the population, the movement of people.
Okay.
It is possible.
Okay.
We have to do that.
Okay.
We are almost there.
Okay. Yet, Doc, you don't want to. But Doc, you don't want to suggest a lockdown. That's not what you are saying. You are saying restricted movement.
Yes, restrict the movement of people in hot spots.
And you don't want to give us explanation as to what you mean by restrict their movement.
I don't want to use your words.
Yes, so I want you to use your own words.
My words, so you can give an interpretation to that.
So
my key word is that let's restrict the movement of people in the hot spots, because that is the only way we can control. Contact tracing is so difficult and cumbersome. It's laborious, and you know the nature of our society. We move a lot, and as you contact trace, you are expanding the circle. You are expanding the circle, and it will lead us to nowhere. For example, if somebody was in the fishing harbor and is now in my constituency, Binduri, you are going to trace him about 900 kilometers away, and when you get there, he would have made contact.
So are you saying that, Doc, you are confusing me?
That if it was restricted, if that fishing zone or community, we decided to restrict movement in that area, nobody would move. So
lockdown, technically you are saying there is lockdown.
Okay.
But you just don't want to use the word lockdown.
If that is the word you want, I have no qualms. For me, let's restrict movement in the hotspot areas.
Okay.
And if we do that, we can control the movement of the virus.
Okay. Okay, Doc, let me...
Contact tracing, when the persons have left their locality and are in other areas, they go and infect the populations. You see, let's do more. Let's do more. And let's do more of the testing.
Okay.
Let's do more of the testing.
Okay.
It doesn't mean that areas who are recording 0 today, we don't have it. We are told that the most active people who transmit the virus are asymptomatic.
Okay.
And so you never know. Your neighbor, you know?
Okay.
You
Doc,
never know because he comes young and strong.
Doc, I would like to ask you a question, but Dr. Nsiansari wants to ask a question. Doc,
Honorable, how are you?
Oh, big brother, I'm fine, sir.
Yeah, I think you are confusing me even the more. You see, restriction, lockdown, can be, you are using it interchangeably. But if you restrict or you lock down, if you lock down, you don't do anything, Honorable, then you should as well not lock down. Contact tracing, when somebody, you give example, somebody who is in Tema who has moved into your constituency. When you go there and then the person say that this is my contact, we take the telephone number of the one that is the contact. Yeah. And then we will inform the health personnel in your constituency that Mr. So and so, Ms. So and so is in your constituency. We have seen somebody who has mentioned the name and the number. Yeah. So please go and then look for her or him and then test. So the contact tracing is not only restricted in where the person is staying. We follow, we follow the person to wherever he is. If the person is in your constituency, and we also test the person, and then he is positive, he will then tell us all the people he has contacted in your constituency. So that's how it follows. So, so restriction without any action is no restriction. You can restrict somebody.
I agree with you.
Yes.
I agree with you that we need to restrict and take action.
Yeah, but the problem is that, Honorable Robert, the problem is that you were downplaying contact tracing. And that's why I'm saying that.
No, I'm not downplaying. I'm only looking at the spread. For example, the example you gave, if the fellow went to my constituency from Tema.
Yes.
Let's say, God forbid, and the fellow is positive. After you have sent the message to the health directorate there, the fellow is positive. And the fellow is an active fellow. He would have been in contact with others. We are expanding.
We shall trace everybody. You see, one thing you should know, the more you test.
So what happens if we are able to restrict the movement so that this fellow doesn't get 900 kilometers away?
Yes, but I'm telling you that once you restrict the movement, you should use it to do contact tracing. You can also do contact tracing, not necessarily making sure that, you see, we are talking about hotspots. Yesterday, for example, I'll give you the figures in Tema. Tema figure is now 2. We had 2 cases in Tema which are positive. In Obuasi, that we were all scared, is 5. We've done a lot of work in Obuasi, if you don't know. We've done a lot of work in Tema, if you don't know. So these are some of the things that we are doing. So sometimes we should try as much as possible to also give praise to especially the health workers who are killing themselves, bending their backs and working. They are doing extremely good job in this country that people are saying we are not doing anything. I know everybody wants things to be done fast. But what I will tell you is that once we continue testing, the cumulative figure will be going up. Because if you get 1 case today, it will not be 5,638, it will be 5,639. But the most important thing is that now we are testing daily. So you know the daily spikes. There will be spikes whether you like it or not. When there's a spike, we quickly go to where it is and then go and make sure that we also do contact tracing.
Dr. Nsiansari, I think Manon responded to concerns. No, Doc, do you get his concerns? That
I get his concerns very well. Okay. I don't think that we are really far from each other.
Okay.
And the issue about the health workers, they're doing fantastic. But we know, everybody knows the number of health workers who have become infected. Everybody knows.
But Doc, are you saying that their infection is as a result of doing contact tracing?
No. The point I want to make is that there could be a lot of cases in the communities that we don't know about.
Yes, that's what we are
testing. And that is what is affecting the numbers of health workers who are making this sacrifice.
But
we are told that over 200.
But I'm surprised you are talking the number of health workers who are positive. Yes, the health workers, the frontline health workers, and all the health workers, even at the background, at the back line, they are the people who are most exposed. In fact, it's even more, the people who are even more exposed are those who are even at the OPD, who are not in the treatment rooms. Because you don't know, if you are in treatment room, you save yourself. So we are making sure that the health workers are well protected. And we take them through infection prevention control. We take them through the case management. We take them through how they should be careful. Any patient that you see, we take the patient as a potential infected person. And this is what we are doing. But if you say the number of health workers who are infected, yes, we know. We are praying very hard that we've put in measures in place for insurance and all sorts of things. That is the way we manage pandemics in every part of the world.
Okay.
So, Honorable, that is how it is.
Okay. So, Honorable, are you satisfied? Because what Doc is explaining unless you have another issue with...
No, I don't have issues at all. What I'm telling you is that we have to hold the community spread.
Okay.
Because there are people walking around who have the virus but are asymptomatic.
Okay.
And
but this is something we know already, Doc.
And that's exactly,
this is something we know already.
What you are doing,
Doc, because I mean, person bed said banter between. But Doc, so we get your point that you have concerns as the committee about how this is happening, especially like you said, we have growing number of community spread, or within the country, you have one person to the other. So thank you this morning. Thank you for joining us.
Thank you very much. And then I would say that next time you rather let myself and my man, we sit together and have a good discussion. Because on phone, we are not able to really
that is so.
Get this.
That is so. So when you return from the conference,
come and see me, Honorable.
Honorable Kuganab, a member of the Health Committee on Nutrition come up from the constituency.